Hi everybody, today I would like to talk about prolonged vaginal bleeding, Beng Lou. Prolonged vaginal bleeding is a long period. Usually the bleeding is around 3 to 5 days in average. Some women will have 7 days. This is okay. If the bleeding is continuous and is progressing more than 8 days, this is prolonged bleeding. Another option will be that suddenly, in the middle of the cycle, there will be a bleeding, a uterine bleeding. This bleeding can be prolonged, it can be heavy, or it can be light and scanty. This situation in Chinese medicine is called Beng Lou. Beng Lou is a sudden occasion of uterine bleeding. So this is the situation. The situation that I want to talk about is a woman that have a bleeding, a vaginal bleeding from the period itself or suddenly in the middle of her cycle. In order to treat this situation, we need to consider if there is not a mechanical problem. So first, I advise her to see a gynecologist and he will see if she doesn't have any polyp or any cysts or myoma that can impact this situation. If it is a hormonal imbalance, we will need to address the specific situation of this lady. So when we are having this kind of a patient, we will need to see the tongue, we will need to see the pulse, the palpation, maybe hand diagnosis, whatever you do, you will need to look if this case is an excessive heat case and stagnation, or is it a cold and deficiency type of a patient. The involvement of a deficiency case is usually due to lung Qi deficiency and spleen not holding blood. One of the reasons is that the Qi is not regulating and controlling blood. Master Tung's acupuncture has a very good impact on seizing and stopping this irregular or prolonged bleeding. But you will need to diagnose. I will talk about 3 important points that you can use, but the diagnosis is important. For example, Sansha E acupuncture point and Liu Wan acupuncture point on the foot. Both have a lung shenjing. So when I have a patient that is a deficient type, I will use Sansha E, which is located between the second and the third finger of the hand, and I will use also Liu Wan acupuncture point. Liu Wan has a lung and a kidney shenjing. If we look from a 5 movement, we understand that metal and water have a downward movement. It is a contracting movement, consolidating movement. Therefore, it has an astringent point of view. So Liu Wan can stop the bleeding. But if I have an excessive heat type, would I use this point? Not necessarily. A heat type of bleeding with an excessive one will ask me to use clearing heat strategy, meaning that I will need to use for example, Huo Ying and Huo Zhu acupuncture point. Both points can clear heat from the heart and the liver. The name Huo is fire. So in Master Tung, we need actually to understand the point's name, since it will tell you the exact functions and indication of his points. With an excessive situation, I will add to Huo Yin and Huo Zhu Huan Chao acupuncture point. It is located on the fourth finger. Therefore, this finger is a liver channel, diagnosis area. So, Huang Chao will be good to regulate the liver meridian. With Huo Yin and Huo Zhu, this can address a case with liver channel disorders with heat and stagnation that leads to uterine bleeding. In this video, I wanted to give you an example for the importance of diagnosis in Master Tung's acupuncture. Don't look only on the indication of the point. Try to understand the energy and the concept of each acupuncture point. Focus on the diagnosis of your patient. You can do it as Master Tung's by looking on the hand. He usually diagnosed the hand. I usually use the pulse and the tongue and sometimes the hand. I also hear my patient's symptoms. I palpate. I see the whole picture. And then I decide, is it an excessive heat or is it a deficiency of the tongue organs, usually the lung, the kidney, and the spleen. And then you will need to choose the correct point in order to regulate the hormones of your patient and to stop the bleeding. So I hope it was useful and continue to do the good job that you do.